and coordinate support across long-term care homes, hospitals, family, doctor's offices, and home and community care partners. That means care providers are supporting each other with on-site infection prevention and control, PPE distribution, staffing support, and access to mobile care. Another great example is the All Nations Health Partners, the Ontario Health Team in Kenora, that has brought together municipal and First Nations partners. When COVID first hit, they quickly established isolation centers in First Nations communities to help protect the health and safety of local residents. They also worked together to set up 17 assessment teams to conduct testing in the community and stop the spread of the virus. And these are just two examples of what our all new Ontario Health teams can do. We can, to keep that kind of success going. So today, I'm proud to announce we're investing to support 13 more Ontario Health teams across the province. This will bring the total number of Ontario Health teams to 42. That's 42 teams across the province, which will provide each and every patient from downtown Toronto to Rainy River with access to 24/7 care coordination and help them navigate our healthcare system. And when all of these teams are fully up and running, 86% of Ontarians will be covered by better and connected care. And we won't stop until every single person in Ontario has access to this new improved model of care. Before I pass it over to Minister Elliott for more details, I want to provide a quick update on the rapid test. We've received about 98,000 ID Now tests from Ottawa, and we're expecting another shipment soon. We have also received a number of pan-bio tests from Ottawa, and we continue deploying these tests as we speak. We're delivering them to areas with greatest needs, such as hotspots and long-term care homes. And we're also sending them to areas where testing turnaround times are a challenge, such as in the northern and remote communities. These rapid tests are game changers for our testing strategy. We will we'll have further details to share very shortly. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon. Last year, long before any of us had heard of COVID-19, our government began an ambitious project to significantly improve the care Ontarians receive and end hallway healthcare. Among many other initiatives, this included the creation of Ontario Health Teams. And as the Premier announced, our government is providing $2.4 million to support 13 new Ontario Health Teams across the province. Through an Ontario Health Team, patients will experience easier transitions from one provider to another, including, for example, between hospitals, home care providers, or long-term care homes, with one patient story, one patient record, and one care plan. These stronger partnerships among hospitals, primary care, home and community care, and long-term care homes will create a connected healthcare system that focuses on the needs of patients and have helped better position the province to respond quickly and effectively to COVID-19. Over the past several months, Ontario Health Teams have demonstrated remarkable responsiveness to the COVID-19 pandemic. They've done so by simplifying the purchase of personal protective equipment, supporting staffing at long-term care homes and assessment centers, launching virtual urgent care initiatives, expanding remote patient monitoring programs to support COVID-19 patients and other vulnerable populations, and by breaking down long-standing barriers to better connected care, both in support of patients and our brave frontline heroes. We look forward to seeing what the 13 new Ontario Health Teams will accomplish. The $2.4 million investment will support these teams in their response to COVID-19 and help maintain hospital capacity through programs that link hospitals, primary care, home and community care, long-term care homes, and other congregate settings and services. It will also support virtual care, online appointment bookings, and patients' digital access to their health information. Our government will continue working with our healthcare partners to establish Ontario Health Teams across the province and ensure everyone is supported by a team. Together, we will build a connected, patient-centered healthcare system and end hallway healthcare in Ontario. Thank you. And now I'll ask Minister Fullterton to come forward.
Good afternoon, and thank you, Minister Elliott. COVID-19 has taught us the importance of continuous learning. The more we learn, the better we can defend ourselves and our loved ones in long-term care. And that's why in July we launched the Independent Long-Term Care COVID-19 Commission to get additional expert guidance on how best to protect residents and staff. And last month, the Commission released early recommendations, many of which our government had already been working on, and we continue that work. We are investing more than $500 million in additional supports for long-term care during the second wave. And we're making sure homes have the staff and the personal protective equipment they need, and that they are prepared to take the infection prevention and control measures needed to manage and contain outbreaks. Today's announcement is in line with one of the Commission's early recommendations. Coordinating care through Ontario health teams tightens the line of defense around people who need care. It's an important approach that will contribute to the work we're doing to create a long-term care sector that provides our loved ones with the care they deserve. And to further protect residents and staff, we are also updating testing guidance in communities with greater transmission of COVID-19. Starting next week, in long-term care homes within public health unit regions identified as orange, red, or lockdown, staff and support workers who provide direct care will now need to be tested for COVID-19 every week. For homes in green and yellow communities, testing will continue every 2 weeks for staff, volunteers, caregivers, and visitors. By increasing testing at our long-term care homes, we will better protect vulnerable residents as well as the staff who are working so hard to keep them safe. Thank you.
We'll go to the phone line for questions.
Right before we go to the phone lines, and before I take questions, I just have to tell the folks out there, it's important that I address the situation with COVID-19. We continue seeing extremely troubling numbers in Peel, Toronto, and York region. And the virus is spreading at an alarming rate in these areas. And I can't stress this enough. The situation is extremely serious. Right now, we're staring down the barrel of another lockdown in these regions. Last week, I asked the Chief Medical Officer of Health to come back with his recommendations on what we need to do to flatten the curve on the second wave. We expect new measures to be discussed at Cabinet and announced in the coming days. Because my friends, we need to hunker down, we need to stick together, and together we'll get through this.
We'll go over to the phones for questions. First question, please.
Your first question comes from Nicole Lampa with CTV News Kitchener. Please go ahead.
Hi, Nicole.
Hi, Premier. A staff member at a middle school in Waterloo has tested positive for COVID-19. The local public school board confirms they are investigating because they were notified by public health that the staff member was symptomatic, infectious, and waiting for results when they went into school for work yesterday. Now a number of other staff and 6 classrooms are self-isolating. What's your response to this?
Well,
And what message do you have to people who still go to work if they have symptoms or waiting test results? And do you have any message for parents worried about this happening at their child's school?
Well, no matter what school or what work environment, if you're showing symptoms and you're going into school, you're putting everyone in jeopardy. You're putting kids in jeopardy. You're putting other educators in jeopardy, and it's unacceptable. If you're showing symptoms, don't go to work. It's very simple. Do not go to work. Go get tested immediately, because the spread is just. Again, I always say it, it's like an Australian bushfire. It gets into a school or it gets in long-term care and it starts spreading. And we have to make sure that you get tested. Do not, I can't believe someone would do it still after just preaching up here nonstop. Do not go to work. Do not go into schools. Do not go to the hospital. Do not go to long-term care. I'll pass it over to the Minister of Health for her comments as well.
Well, I can only really reiterate what the Premier has just said. It's the most important thing that any of us can do is to follow the public health rules that we've been talking about since this pandemic began, about maintaining physical distancing, wearing a face covering if that's not possible or where it's mandatory, washing your hands frequently and thoroughly, and of course, staying home if you're not feeling well, because it does endanger you, but it endangers everyone that you're near. Particularly when you're dealing with children in a school. So we ask people to please stay home if you're not feeling well, get tested, and don't go out until you receive the tests. If it's normal, that you may be all right. But if it's not, then you need, of course, to quarantine for the proper period of time for 2 weeks.
Follow-up?
The medical officer of health for the Guelph area issued a letter last night saying the spread of COVID is happening in people's homes, saying birthday parties, sleepovers, play dates, coffee dates, game nights, and dinner parties are spreading the virus. Are you willing to tell children and parents they shouldn't be having sleepovers and birthday parties or dinner parties as we head into the holiday season? And since your government, is your government looking into further tightening current social gathering restrictions for the orange, red, and lockdown zones?
Great question, actually. I've been saying that over and over again. Do not have birthday parties. Do not have sleepovers with having kids' friends over. It's dangerous, and it has to stop. As I said, we're looking at lockdown. If this continues in Peel and Toronto and York, I'm telling you, I keep saying it. I keep seeing the numbers climb. My job is to protect the health and safety of every single Ontarian. And if it means locking down and we get a report back from public health, the chief medical officer, that's what we're doing. We have to stop this. The hospitals around, especially around Brampton and Northern Etobicoke and other areas within Toronto, they're hitting capacity. So we need to be responsible. The health experts in this province, the government can throw everything we have at it, which we have. But if people aren't listening, like the people, as I said yesterday, who in the right mind would hold a party for 100 people in public storage? Like who would do that? Then they go out and they start spreading it right across the board. So it's frustrating to say the least.
Next question.
Your next question comes from Lorenda Redikoff with CBC News. Please go ahead.
Hi, Lorenda.
Hi, Premier. You mentioned the situation with hospitals and how close they are getting to that critical threshold. What are you doing at this point? What are you going to do?
Well, we're going to get advice off the chief medical officer. We're going to bring that advice to cabinet, and we'll have an announcement on Friday where we're going here. But again, I've I mentioned it before, I won't hesitate to lock things down to protect the health and safety of every person in this province. Without the health and safety, we don't have an economy. It's as simple as that. We'll take a more targeted approach in the hot spots, and I'm not recommending by any means across the province. But I'll give you an example. Ottawa, you folks are champions out there. You know, you saw you were in a problem there, and you reacted. Now, if anything, you're going the other way compared to other regions. And a lot of people contact this, no fault of their own. Let's be honest, there's no fault of their own. And then there's other people that go out to these parties, go out to the big celebrations, having 4th of July fireworks last Saturday. It's unacceptable. And everyone thinks it's a big joke and everything's fine. We'll see how fine it is. Because I'm done with this. I'm done with people holding parties, having get-togethers, and unfortunately, everyone in those regions have to hunker down. They end up paying the price because careless people out there holding these parties. It's not going to be tolerated. We got to protect the health and safety of people.
Follow-up?
CBC spoke with Dr. Anthony Fauci, who talked about the situation in Canada now, saying we had been doing well, now we're getting into a lot of trouble with community spread. And he suggested widespread testing among asymptomatic people. Is that something you're looking at going back to doing?
Well, right now we have the capacity of 50,000 tests a day. We're still leading the country, bar none. All provinces combined still are not matching our testing that we're doing, and we're going to continue doing testing. Long-term care, I've asked the chief medical officer to come back. It's critical we stop the leak. Again, 100% testing. 100% testing for every staff member, every single visitor that goes in there. No excuses anymore. Right? It's not coming in through the ceilings, not coming in through the walls. It's coming in through the people visiting and the health workers. And by the way, this is not a knock against health workers. They're heroes. Without them, we wouldn't even have a system. So I want to thank them. But if we don't lock this down 100% and have collaboration with staff and people coming in there, it's just going to continue. You got a leak in the ship, you plug the leak 100%. Not only that, we have to do the testing 24 to 48 hours. They're doing a test on a healthcare worker and then getting results a week later. You might as well just toss that away. So we followed up again with a meeting. I've told the public, I had a meeting 2 days ago. We followed up again yesterday, putting a strong plan together for that. And we're having another meeting this afternoon and just going to lock this down tight as we can.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. Peel's medical officer of health expressed frustration over the lack of protection for essential workers, so truck drivers, medical supply distributors, and food processing employees. And he says the reason Brampton is seeing cases on a significant rise is because too many employers are not cooperating with public health investigations, and employees are still showing up to work with symptoms because they're afraid of losing their jobs. He says a lockdown will do nothing. And we know the province hired a slew of labor inspectors, but what else is the province doing or going to do to address Dr. Lowe's frustrations?
Well, first of all, Dr. Lowe knows, and he's a great doc. I've talked to him a few times there, and I'll give him a follow-up call. But he understands no one can lose their job. We passed that legislation. So if you're sick, you aren't losing your job. Stay at home, protect the health and the well-being of where you work and your own family. And as for PPEs, there's more PPEs than we know what to do with. We can supply not only Ontario, Canada. There's no excuses with PPE. We have plants all over Ontario pumping out surgical masks, pumping out face shields on an ongoing basis. So I highly recommend companies go out there, they supply the face coverings, or the employees bring a face covering in. It's as simple as that. And we've also mentioned, if you are working side by side and you can't physically distance, you have to wear a face covering. And if your company is saying you don't have to and you're working 6 feet, within 6 feet, then that's dangerous. And we'll have inspectors. We've had over 25,000 in inspections so far. We're going to continue ramping that up in the hotspots of Peel and Toronto and York region.
Follow up.
Thank you. And my follow-up, Minister Lecce sent out a statement today saying that after consulting with Dr. Williams, there would not be an extended Christmas break. And this statement was sent out about 24 hours after he said that he needed a week or two to consult with Dr. Williams. So what's changed in 24 hours?
Well, what's changed? He put his plan in front of the health table. Dr. Williams said, no, the safest place for our kids, and it's working to the credit of Minister Lecce and the teachers and school boards and principals and parents. Parents and students, the safest place for their kids are in the schools, not when there's public spread out there. The safest place with the cohorts are in schools, and so far, I'm knock on wood, it's working fairly well. We have out of 4,828 schools, we have one that's been shut down. Over 99% of the kids are COVID free, and that's the same with staff. So That's the safest place. And after he showed it to Dr. Williams came back and said, no, this is the safest place. Again, reacting quickly, being decisive right away. We wanted to come out here today and say that the kids will be in school.
Next question.
Your next question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier. In the last 15 days, we've had 21 deaths at long-term care facilities in Hamilton. And today, the majority of deaths were in people over 80. Why are we having such difficulty keeping people safe in long-term care facilities after all the experience that we've had in the last almost year?
Yeah, so I'll pass it over to the Minister of Long-Term Care. But again, how we say, I'm not a health expert, but I don't need to be a health expert to figure it out. When the virus is coming in, it's coming in through staff and it's coming in through the visitors. And I want to see data, as I mentioned to the Minister of Long-Term Care, I want to see data of 626 long-term care homes that 100% of the people are getting tested, not every 2 weeks, every single week. We have to lock this down. No excuses anymore. No, I don't want to take a test, or no, we're getting a test. It's simple as that. I'll pass it over to the Minister.
Thank you. And it's a very important question because we have been working round the clock, collaborating with the homes, the sector, Ontario Health, Public Health, our Chief Medical Officer advice, all the tables that provide us with information as to what we can do next, including the commissioners that have recently released their early guidance to us. And so when we look at the testing, as the Premier has said, with the incubation period being anywhere from about 10 to 14 days, looking at that 2-week cycle for the testing and understanding the public health expert and input. Originally, that was every 2 weeks for our residents in outbreak, for the staff coming in, and for caregivers or visitors coming in. And certainly the residents get tested more frequently depending on the situation in the home and their symptoms or lack of symptoms. So what we have done really is understood the science and taken the expert advice. But science keeps evolving, and there is evidence that doing a weekly test will pick up people who might not have the viral load at a time when the test is done. So they get through the screening and the testing with a false negative. So by going to a weekly testing, we'll be able to pick up people that might have just been off for their timing of the 2-week test. We have to do that. We also have to make sure that our homes are being supported in every way, and we're continuing to develop layers of support for them, learning from the first wave. There are medical enhancement support teams, basically rapid deployment teams using the public health and Ontario Health and our hospitals, all of this integrated process. So there is a constant learning, and the science is evolving, and we're continuing to take our measures and putting dollars behind that. Billions of dollars.
Follow up.
Thank
Okay, in Niagara, the Chief Medical Officer of Health has put more restrictive measures on restaurants, and he's being criticized publicly for that. And people have gotten a hold of his cell phone number, and they posted it online, and he's getting harassing phone calls. Is that appropriate? Are you worried about that sort of thing happening to regional medical officers of health?
I'll pass this question to the Minister of Health.
Well, he's doing his job, and we're very grateful to the Chief Medical Officer of Health, Dr. Williams, and all of the local medical officers of health and all of the 34 public health region across the province. He's doing his job. He's trying to protect the people in his area. Of course, the local medical officers of health can put in Section 22 orders, which will have more stringent provisions than what the province might dictate, because they know the local conditions best. And I really hope that people will take these measures very seriously, not harass the medical officer of health, but follow his direction, because he's only trying to keep people safe and try and bend the curve downwards. So all I can ask is for people to please be patient, please follow the rules, and we will get there together. But we can't do it without everybody playing their part. And I know often people will say it doesn't really matter if we have this gathering or this dinner party, it's not going to affect things. but it does. That can start a spread of COVID-19, which then expands exponentially, and then we get into a situation where we have to contemplate lockdowns. So please follow the directions of both the provincial chief medical officer of health and your local medical officer of health as well.
Now, just to just to follow up on that, Randy, I got to ask the people that are harassing the chief medical officer, would you be harassing your own doctor if he said you should follow these protocols? It's the same thing. This medical officer of health in Niagara, they're working their backs off to protect Niagara, not to hurt Niagara. And you think this is great to give out his phone number and start harassing a doc that's been working their back off? It's ridiculous. I'm getting so tired of these anti-maskers. The world is fine. Everyone just go out there. Yeah, it's okay for some people. If they're young, if they get it, God willing, they get through it. Again, how about their parents? How about their grandparents? How about and then my prayers and thoughts and go out to the teacher that lost her life over COVID. You know, how about other people? Guys, get it together, because we're at a critical stage. And I'm at my brink to say enough. So be prepared on Friday, then you can look at each other and say, why are we in this position? It's frustrating. We have to start listening. No more parties, no more nothing. Or this is going to be at 6,000 cases a day as we saw the trend. I just can't stress this anymore.
Last question, please.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Premier.
Hi, Rob.
To delve a little bit deeper into the statistics today, I noticed in the last 7 days, deaths are up 50% from the previous 7 days. You know, until a couple of weeks ago, we were down in the single digits in daily deaths most days, and now we've been in the 20s, and today we topped 30. Have you waited too long to take some more measures?
No, not at all. You know, Rob, we're doing everything in our power. You know, I listened to all the docs and endless docs. We got off the phone with OSJ today, and I want to thank them for the great job they're doing, the Ontario Hospital Association. Everyone is just sending in information, rapid fire. We listened to our chief medical officer, and with those 32 deaths, it's terrible. We're seeing the mortality rates go up. We had 26 in long-term care, and another 6 outside of long-term care, and we have to do something. And just stay tuned on Friday, because if you look at the cases, you look at Peel, 463, and this is before we get the results of last weekend, because it'll take 10 to 14 days to see the numbers of what happened last weekend. We're at 463 cases in Peel, and we're a little over 400 and some odd cases in Toronto. Peel is 1/5, Brampton's 1/5, or Peel's 1/3 of Toronto. So guys, we gotta knuckle down. Simple as that. And I just see it out there. Some people are just throwing up their hands and saying, "Oh, if I get it, I get it." That doesn't cut it anymore. So we're just bear with me till Friday here.
Follow up?
Yeah, in light of all that, do you think it's time for more public health units to start listing the names of restaurants or businesses or whatever where they've had problems with cases? I know in Hamilton, for example, they recently named a restaurant that was completely flouting the rules. So is it time to really go public with that kind of stuff?
You know, I'm not into destroying people's livelihoods or restaurants, but in saying that, the real bad actors that just don't care, by all means, the public media, local media, I should say, you want to put it out there if they're just being reckless, but be very, very careful, because there are restaurants, and I truly believe the vast majority are following the protocols, are listening to people, and they're doing everything they can to protect their business and just stay afloat. I get it. So just a couple bad apples or painting a broad brush across all restaurants is just not accurate. Vast majority of restaurants are following the protocols. And if you don't, if you don't see the protocols in place, I wouldn't even go to that restaurant because you're risking it.
Thanks, everyone.
Okay, thank you so much, everyone.